So this is a topic that has become more and more popular over the last few years as more and more people are beginning to understand and appreciate how important it is to have a good airway. This is a great example of what happens in obstructive sleep apnea. The lower jaw is back, and you can see all these pharyngeal tissues here. By the time you get the tongue and all of the tissue in the way, all of a sudden there's no more room for the airway. So a lot of times what happens if you have obstructive sleep apnea, the body's response is to clench. And so all night long, I always tell my patients, you're fighting 3 battles at night. You're clenching, and you wake up exhausted. The consequences of obstructive sleep apnea are you're 37% more likely to have hypertension, 76% more likely to have congestive heart failure, 80% more likely to have loud snoring, and many other things. Those are just the main ones. And so an easy way to get this treated is to work with a sleep physician, which we do work with, and either get a CPAP machine, or if you're looking for an alternative to a CPAP machine, we can make you a sleep appliance. So this is another example of a sleep appliance that we make. This is the upper and the lower, and it kind of fits together just like this. Again, the idea being we want that lower jaw not to be able to fall back at nighttime. So this kind of holds the patient in that more forward position. This is an excellent alternative to the CPAP machine, especially if you're only mild to moderate. This is the kind of treatment that just makes such a huge difference for our patients in their lives. I can't tell you how many people have said to me, this is the best thing you've ever done for me. I love dentistry, but this is the kind of stuff that makes a huge difference for people in their overall health and in their life.